This is a tutorial on the heart and some of the major vessels that lead to the heart and from the heart. So here we're looking at an anterior view of the chest with the thoracic cage and the muscles dissected away. So you can see the heart sitting centrally in the mediastinum, which is this central compartment of the chest separating the pleural cavities on either side. So the heart, as you can see, is angled to the left, so the apex of the heart is angled down and to the left, and you can see it sitting on top of the diaphragm, which is this flat muscle here. So in the anatomical position which we're looking at now, the heart has several surfaces. So the surface that's in contact with the diaphragm, the inferior surface of the heart, is known as the diaphragmatic surface. This right side of the heart, which is in contact with the right lung, is called the right pulmonary surface, and conversely the left side, which is in contact with the left lung, is called the left pulmonary surface. The anterior surface of the heart, which is in contact with the sternum, is called the costosternal surface. The back of the heart, which you can't see in this particular view, is known as the base of the heart, and this point here is the apex of the heart. So it's important to note the orientation of the heart in this position. So when you're looking at it from this view front on, you're seeing mostly the right side of the heart. So from this view you're seeing mainly right ventricle. So just to quickly go over the basic structure of the heart and the function of the heart can be thought of as a dual pump. So you've got a pump to the lungs and a pump to the body. So deoxygenated blood is received from the rest of the body into the the right atrium. It is then pumped into the right ventricle, which then contracts to send blood out through the pulmonary trunk into the lungs, where it receives oxygen. Once oxygenated, the blood is returned to the heart via pulmonary veins into the left atrium. The left atrium contracts and sends blood into the left ventricle, which then sends blood out via the aorta to the rest of the body, and this blood is oxygenated because it's been received from the lungs. So just when you're watching this tutorial, the blue coloured vessels are veins and the red coloured vessels are arteries. So the colour of the vessels doesn't actually relate to whether or not the blood is oxygenated in this model. So the blood that is sent out of the right side of the heart to the lungs is deoxygenated, but on this model you can see that the pulmonary arteries are actually red because they're arteries. So this is the only artery that carries deoxygenated blood in the body. And also you can see the pulmonary veins, which are returning from the lungs into the left side of the heart, the left atrium, are blue in this model because they're veins, but again these are the only veins in the body that carry oxygenated blood. So just to point that out. So between the atrium and the ventricles you have valves which prevent the backflow of blood. So between the right atrium and the right ventricle you've got a valve known as the tricuspid valve, and I remember the tricuspid valve as being on the right because tricuspid contains the letters RI, so tri, RI, right, if you know what I mean. But if not, just try and remember that the tricuspid valve is on the right. And on the left, between the left atrium and the left ventricle, you've got the mitral valve. You've also got valves between the vessels that lead away from the heart and the ventricles. So between the pulmonary trunk and the right ventricle, you've got a valve called the pulmonary valve. And between the aorta and the left ventricle, you've got the aortic valve. So there's 4 valves that you need to remember. The tricuspid one on the right between the right atrium and the right ventricle, the mitral valve between the left atrium and the left ventricle, and you've got the pulmonary and aortic valves. Don't worry too much about what these look like and the structure of them, because I will be doing a more detailed tutorial on the structure of the heart, including blood supply to the heart, all the different sort of bits of the heart, and I'll be looking at the valves in more detail. So in this tutorial, what I want you to remember is you've got the 2 atrium, which pump blood to the 2 ventricles, and the ventricles pump blood to through the major vessels. And between the atrium and ventricles, you've got the mitral and tricuspid valves, and between the ventricles and these great vessels, you've got the pulmonary and aortic valves. So the great vessels are those vessels which take blood directly to the heart and take blood directly from the heart. So you've got 4 great vessels. You've got the vena cava, you've got the pulmonary trunk, the aorta, and you've got the pulmonary veins. So blood is brought to the heart by the vena cava. You've got the superior vena cava and the inferior vena cava. So you've got these veins which drain into the vena cava called the brachiocephalic veins. So you've got one on each